through the basics of autism, what does it entail, and at the end we'll do a question answer session, and I'm very privileged to have National Autism Society with us tonight. You can answer all the questions.
That's Humphrey.
I'm
Autism Guernsey, National Autism Society.
There we go. All right.
But we're kind of prepared, aren't we?
Yeah.
Bookends.
I think the first thing to address is the technical term is autistic spectrum disorder, and the word disorder is quite difficult because not everybody who has autism is disordered. A disorder has to get in the way of your daily life. It has to hamper your function. Has to really create lots of clinical type features like anxiety, panic attack, stress. There's lots of areas where autism can be a disorder. There's lots of areas where autism can just be a different way of relating, a different mind. And it doesn't have to be classified as a disorder. So most of what we're talking about tonight is the disordered part of autism. So the parts where it does get in the way of a daily functioning, and it can benefit from having some additional support and additional help. So just a brief recap on the history, what we know about autism. So it's originated back from Leo Kanner's 1943 investigation. He described 11 children who had a previously undescribed syndrome, and when we look at the characteristics that he found about them, we can see some similarity in what we're having today. So there's an inability to relate to others, a failure to use language to convey meaning, obsessive desire for the maintenance of sameness. I love the way he puts that. Everything's just got to be the same. If we have lots of change, we create lots of anxiety. Anxiety, one of the biggest features, and we'll be touching on that quite a bit during this talk. Congenital onset, so it's there since birth. That's not something that was created later on. And the term comorbidity means that there can be lots of other things attached to these people. So things like anxiety disorders and depression, those are things that can co-occur or be comorbid with autistic spectrum disorder. And the range of learning difficulties that can occur with a condition range between 25 to 70%, which is a huge variation. And it really just illustrates the difficulty in assessing the intelligence, because a lot of it is about communication. We communicate in a neurotypical world, and it's not geared for communicating in an autistic world. So we can't accurately gauge intelligence as we define intelligence as a neurotypical person. Since Kanner, what do we know? We know it's a spectrum disorder, and it's a wide amount of variability. So if we look from Kanner's original thing, in terms of increasing variability, Kanner's autism, pure autism, there's not a lot of variability. It's all pretty much the same. People who are relatively locked in their world. And as you move through the spectrum, have this pervasive developmental disorder, which is you have a little bit more variability, and then you get to the high-functioning autism, or what used to be termed the Asperger's syndrome. Lots of variability, lots of difference. No two people are the same. So this is much prefer this slide was created by somebody with autism, and he said, well. He uses the wild plant analogy. No two wild plants grow in the same way. Some wild plants overgrow and some don't. Some hardly see the light of day. Some excel in other areas. And an autistic person could be likened to a wild plant in that they each grow differently depending on what they're exposed to. Lots of variation. And he put neurotypical people as cabbages. They're all the same. So that summarizes his view of it. And it's a nice description because there's so much variability. It's hard to say everybody on the spectrum has this, and this, because there is a lot that we will miss if we just try and put them all into one simple little box. We know that they are not rare. The latest estimates from the Centers for Disease Control in the States estimate that 1 in 68, which is 1.5% of individuals, have an autistic spectrum disorder. The variability for males is 1 in 42, which is exceptionally high for a condition or a disorder, and for females 1 in 189. We know it's a neurodevelopmental disorder, so it's related to the way your brain develops and grows over time, depending on what you are exposed to, as well as to the underlying structure of the brain. We know it's got a biological basis. It's not based just on your personality. There's a biological basis, the way that your brain has an impact on how you function. We know it can be identified early. We know that it's no respecter of race or status. It occurs across all groups. It's not just a middle-class white phenomenon. It's across all groups. We know that they're common and there's a dramatic increase in what we call it prevalence, the existence of them. So it's 3 to 4 times higher than what we found in the 1970s, and it keeps getting higher and higher. And it's not because more people are becoming autistic. I think we are just getting better at identifying it. I'm quite old, and I can remember when I was young, there were people in my year group who would be different and would have all sorts of different labels attached to them. And looking back now, I can recognize, yes, they were on the spectrum. But at the time, it was never recognized. So we've got a lot better at identifying it and better diagnostic tools. And there are some environmental factors, and increased parental age can play a role. But I think we just are getting better at recognizing it. So your core characteristics, what we're aware of, you would have heard the triad of impairment. So there's 3 areas that we focus on, and we'll draw those out a little bit later. So reciprocal social interaction, what does that mean? That means, any idea? This is exactly what it means. No interaction. So be able to recognize that you've got a responsibility to respond to a question in a certain way, in a certain manner. Impairments in verbal and non-verbal communication. So non-verbal communication, not looking away, and with no intent to cause offense. It's just you don't recognize that the verbal part needs to match the non-verbal in terms of levels of openness. If I was doing a normal TED talk, I would be making a point like this, and that verbal, non-verbal stance to say this is a really important point. Or I'd take my glasses off and put my mouth and say, this is really important. That non-verbal stance communicates something which on the spectrum is often missed. And we know it is restricted, repetitive, or stereotyped behaviors or interests. So not a lot of variation, and sometimes people like doing the same thing over and over again because that reduces anxiety. So that's the triad, the 3 areas, and we'll go into that in a little bit more detail. We used to have the DSM-4, so that's the latest one is the DSM-5, the Diagnostic and Statistical Manual of Mental Disorders. The new revision has caused a little bit of a stir amongst the autistic community because it's taken away the term Asperger's syndrome, which for a lot of people was a massive source of identity. They quite liked having the term Asperger's syndrome, the term Aspies. There's some great websites out there like Wrong Planet, where people with Asperger's all communicate together and say it was a really nice form of identity for them. But diagnostically, they've taken away that term. So it's all autistic disorder on that spectrum. I don't think it's going to change for young people term. And really, if we're dealing with autism, we shouldn't be changing the classification anyway, because people with autism really struggle with change. So anyway, that was their determination. But it's all now autistic disorder, and they've combined a number of elements that we'll go through now. I'll share with you a little bit of my hell. So this is the DSM-5 criteria, and I'll try and break it down for you. So we've got criteria A, so persistent deficits in social communication, how we talk to each other, social interaction, how we get along with each other across multiple contexts, so it's at school, at home, as manifested by all of the following. So to be diagnosed, you've got to have all of the following criteria. So number one, deficits in social emotional reciprocity. So not picking up on other people's cues, not giving back what's given to you, ranging from an abnormal social approach. So you might notice somebody storming into a place where they're supposed to be quiet and being really loud, or asking for something in what is perceived as a rude manner, even though it wasn't intended to be rude, so an abnormal social approach. A failure of normal back and forth conversation, so saying hi and expecting a hi in response, and maybe an add-on, how are you, and not getting that, because it's not understood that that's what's supposed to happen. Reduced sharing of interests, not sharing a lot, reduced emotions, affect, or failure to respond to social interaction. So that's one of the criteria. The next one, deficits in non-verbal communicative behaviors. So eye contact is particularly difficult in autistic spectrum conditions. It can be almost painful to make eye contact and sustain eye contact, but it is an area that is often learned, and young people will force themselves to practice it because they know it's important in a neurotypical world, but it's uncomfortable. It can be difficult to maintain. Body language can appear unusual. Not using gestures, so not pointing, can we go over there, or come over here, or waving goodbye, and sometimes there's a lack of facial expression. So this is all very clinical. As I say, this is my hell. This is what I have to try and break down in my DSM-5. The third one, deficits in developing, maintaining, and understanding relationships. So changing how you behave in different relationships with different people. Learning why it's important to share things with people, and how that affects other people. Difficulty in making friends. So those are all three criteria for the first one. The next one is you have to have two of the following in terms of repetitive or restricted patterns of behavior. So you can have stereotype or repetitive motor movements. So flapping hands or spinning around or using objects in a repetitive manner. Speech, simple motor stereotypes, so saying certain words over and over again. Lining up toys, flipping objects, focusing on parts of objects rather than the whole of the object. A lovely word called echolalia, so repeating what somebody else says and just repeating that word over and over again because it sounds really nice. And using almost odd phrases that don't kind of make sense in a neurotypical world. An insistence on sameness, really liking lots of rituals and patterns to take place, because that helps reduce anxiety. Anxiety is a key feature in these diagnoses. Highly restricted or fixated interests that focus on they're kind of abnormal in intensity. So people develop a huge interest in a small area. So they might be absolute experts on stamps that are sent between 1943 and 1947. So we know girls tend to have better connections than boys do. Boys have more neurons in the motor cortex. But that corpus callosum doesn't have as many connections in an autistic spectrum condition as in a neurotypical connection. And it's even harder for boys. A study that they did a while ago when they analyzed the speech of toddlers. So they put voice-activated recorders in them and analyzed them for a couple of weeks and looked at everything that was coming out of their mouths. And for the girls, about 80% of everything that was coming out of their mouths was relational. They were talking to their dolls and friends and parents and talking to people and relating really well. And for the boys, about 60% was just noise. That was all. It was brum, 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 ba, 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 ba. Nothing to do with people whatsoever. And you'll see why in a bit, why we think boys have more of a role to play in that. You may have heard of the difference in male and female brains as being described between boxes and wires. So a male brain is typically described as a series of boxes that don't touch, whereas a female brain is all interconnected wires. Females are generally far better at being able to multitask and bring emotion and understanding, as well as have a conversation on the phone and do something else at the same time. Whereas men can only do one thing at a time. I can do this, I can't do that as well as this because I'm in this box. When I've finished this task, I get out of this box and I can get into this box and I can do that, and I'm really good at that. Whereas women can do it all. Men we're brain damaged, and it's not our fault. Our brains are washed in testosterone, and yeah, have pity on us. The best box for the men is a box that I absolutely love. It's called the nothing box. You can get in there and think of nothing. And women don't understand that because their minds are active the whole time. Whereas for a man, you can say, "What are you thinking about?" And he says, "Nothing." And women don't believe him. But we have a nothing box. It's a lovely box to be in. We can think of nothing. But the female brain is kind of more connected. Lots more wires in that corpus callosum. So, any idea why I bring up Borat?
Because he's a proper man.
Yes, he's a proper man. It's his connection to one of our top researchers in autism. So Simon Baron-Cohen is professor at Cambridge, and Sacha Baron-Cohen is his cousin. So our top researcher, Simon Baron-Cohen, came up with this description of an autistic brain as an extreme male brain. It's not that well wired up in terms of bringing emotions and all of that together. It's more like lots of boxes. All right. Speech aspects. So what we know about speech is that people on the spectrum tend to be revealers of truth. They say what they see. They're not that fussed about how you feel about that. They tend to vocalize what they're thinking, regardless of who's around. They're primarily interested in an exchange of information, just the facts. And that's really nice. Just the facts is all I need, because that helps me get on with my life. Not really that interested in appropriate topics, because it's really hard to gauge what is appropriate and what's not appropriate. And that's maybe it's not really somebody with an autistic spectrum's problem. That may be the problem of somebody who's neurotypical. There's a group of people on the spectrum who say that, well, why should we have to conform in a neurotypical world? Why should we have to change what we feel and what we do to fit in with your world? And I quite like that stance because it's quite empowering. It doesn't make you feel like you're disordered and you have to fit in with everybody else. But that's an area where people will clash. What's appropriate, what's not appropriate to talk about. Not a lot of dialogue, so back and forth in terms of communication. More monologues than scripting. Recognizing and accepting different points of view can be difficult because of what we call mind blindness. So my mind has difficulty recognizing what your mind is thinking about if I'm on the spectrum. So it's hard to see your point of view. Appreciating the level, the volume at which we speak can be difficult. And if anxiety is in there, it really affects your speech delivery and your fluency. And there can be a real literal interpretation. Never tell a young person with autism that a cat has 9 lives. That doesn't tend to end well. We can just see from this statement that inflection has a huge role to play. So if we put the inflection on I didn't say she stole my money. It means that somebody said it. I didn't say it. If we say I didn't say she stole my money, I definitely did not. I didn't say she stole my money. I may have inferred it. I didn't say she stole my money, someone stole it. I didn't say she stole my money, she did something with it. I didn't say she stole my money, she stole someone else's. I didn't say she stole my money, she took something else. Just by changing the inflection, we change the whole meaning. And for somebody on the spectrum, that can be really, really difficult. This is a huge area. Seriously, this needs a week on its own. So my apologies for only having one slide on it, but it is something that is huge. We all have sensory systems which process information and help us to make sense of the world. So on the autistic spectrum, using sensory input in a meaningful way is a lot harder. Basically, the sensory channels in the brain can be a lot wider or a lot narrower than in a neurotypical world. Can even be sitting in class under a fluorescent light, and nobody would be aware that this fluorescent light is causing a problem but somebody on the spectrum. For them, it can cause massive anxiety, and they might not even be aware that it's the fluorescent light causing that. That's how sensitive the sensory input can be. And it's a huge area to work on. And there's sensory integration therapy is vital. Having a good sensory profile, knowing where you are sensitive, what happens when you taste certain things, when you have certain textures in your mouth, sensitivity to clothes and labels, weighted blankets, just that pressure, having lots of pressure around you can calm all the senses down. Using snooze-in rooms or multi-sensory rooms can be really helpful in calming the sensory input down, because when that sensory input is out of whack, your anxiety goes through the roof, and often you aren't aware of the link. So, as I said, some individuals are oversensitive, others are undersensitive to sensory input. So your main areas of difficulty in an autistic spectrum disorder, as opposed to condition, are attention, motivation, knowing why you have to do things. If it doesn't make sense to you, it may make sense to your teacher, but it may not to you. Sometimes motor planning, so it can be some clumsiness and coordination difficulties. Executive functioning, so knowing how to plan and organize your time. Emotional regulation, stopping yourself from having meltdowns. Understanding hidden social rules. Why do we have to speak quietly in a library? Just general social difficulties, not understanding why you don't fit in, and feeling really difficult about not having many friends and not being invited to things. Being very practical about things rather than deep thinking. Obsessive interests, liking the same things over and over. Black and white thinking, find it really hard to find the middle ground. You often are poles apart. Be quite rigid in your thinking and sensory input. Those are your main areas of difficulty. Horrible term, comorbid, but it just means coexisting conditions. So over 84% of people with an autistic spectrum disorder also meet the full criteria for at least one anxiety disorder. We find that the same sort of underlying brain structure that exists in autism can also mimics what's happening in post-traumatic stress disorder, where you are hyper-vigilant, where you're always looking for something to go wrong, where you are hyper-alert. Panic disorder, where you will have multiple panic attacks and not really understand the cause, and sometimes there isn't an identifiable trigger for you. Phobias and obsessive compulsive disorder. So it's a similar profile, and it can happen a lot on the spectrum. The overactive limbic system with an underactive frontal lobe means that your emotions can get dysregulated, so you can get angry really, really quickly and lose the plot really, really quickly. And anxiety and depression are really common in ASD adults. Temple Grandin, I quite like her work, but this captures the primary emotion of autism is fear. This might help explain it a little bit more. So reality to an autistic person is a confusing, interacting massive events, people, places, sounds and sights. There seem to be no clear boundaries or order or meaning to anything. A large part of my life is spent trying to work out the pattern behind everything. Set routines, times, particular routes and rituals all help to get order into an unbearably chaotic life. Trying to keep everything the same reduces some of the terrible fear. So walking into an unstructured environment can cause panic for some people on the spectrum because they're not sure what's going to take place. The prospect of change and change that isn't announced is tremendously disabling. And just picking up on the body's own ability to recognize stress. So your stress chemical in the body is cortisol. High levels of cortisol equals high levels of stress. And when it was analyzed in people on the spectrum, the level of cortisol was really elevated under a stressful condition, but people didn't recognize it. So they weren't able to adjust their emotional response, saying, I'm getting stressed, I need to take a breath now, I need to calm down, I need to walk away from the situation. Basically, it would just ramp up and up and up without being aware of it until it exploded, and that's where we went into meltdown territory. So in terms of the differentiation, in classic CAMHS autism, they have lots of rituals and routines. In high functioning end of the spectrum, they have rituals and what can sometimes look like OCD, but it's not always obsessive compulsive. Obsessive compulsive disorder is when you have intrusive thoughts, that's the obsessions, that something terrible is going to happen, and in response to that you develop compulsions, so you do behaviors to stop the obsessions, to kind of minimize them. Whereas, so they are always dystonic, it means they always cause distress in OCD, you hate these thoughts. Whereas in the autistic spectrum condition, people can sometimes like to do the same thing over and over again because it's quite calming. They're syntonic, they're actually quite helpful to do things the same way. And it could look obsessive compulsive, but it's not because it's calming, it's not causing distress. In classic autism, there's extreme sensory sensitivity, and there's milder levels that often aren't understood or picked up in the high functioning end of the spectrum. In classic autism, they're very much locked in their own world and have great difficulty interacting with other people, acknowledging the presence of other people. Whereas in high functioning, we have lots of relationship complications. People can sometimes get through primary school okay, where relationships are quite concrete and fairly easy to navigate. And as adolescence hits and hormones come into play, it can cause tremendous difficulties. And a lot of young people will try and model and watch like reality TV shows like Geordie Shore to try and work out what am I supposed to say in this situation, and sometimes get the wrong end of the stick. In classic autism, we have the same anxiety, depression, and anger. There used to be a myth that people on the spectrum didn't experience emotions, they were emotionless. That's absolutely wrong. They experience emotion intensely, but sometimes they don't understand what they're experiencing and can't communicate that effectively. And in classic autism, it tends to be all about that. There's not a lot of other things going on, whereas there's a wide comorbidity of dyslexia and dyspraxia and other things that can go on, ADHD in the high functioning part. So your take-home points, we know it's neurodevelopmental disorder with 3 key areas, so it's social and emotional behavior, communication, and restricted stereotypes and repetitive behavior. We know it's increasingly prevalent. That's mainly because we're getting better at diagnosing it and more people are becoming aware of it. Increased parental age does seem to play some of the role. There's a strong overlap between the neuropathology of autism, anxiety, and depression. Just because you have autism doesn't mean you can't also have anxiety or depression. Often you will have all 3. Emotional regulation requires a lot of external teaching. In America and parts of the UK, they do applied behavior analysis or ABA therapy, which lots of external scaffolding around this young person to help them recognize their emotions and control their emotions better. You need a lot of wraparound support to help that. And it's a lengthy process. You have to be persistent, you have to have patience, and you have to relish every success.